Assalamu alaikum. My name is Samra Abbas and the topic of today's presentation is Parkinson's disease. The content of today's presentation are introduction, what is Parkinson's disease, causes of Parkinson's disease, medication for Parkinson's disease, the role of medicine in the Parkinson's disease, treatment, therapy treatment and chemistry of Parkinson's disease treatment. In introduction, Parkinson's disease is a chronic progressive disease of nervous system characterized by the cardiac figure of rigidity, bradycardia, tremor, and postural instability. Parkinson's disease, which was first described in an essay on shaking palsy in 1817 by a London physician, James Parkinson, has probably existed for thousands of years. In India, the crude age adjusted prevalent rates of Parkinson's disease per 100,000 population is 14 in northern India, 27 in south, and 16 in the east, while is 363 for the Parsis in the Mumbai. Parkinsonian. Parkinsonian refer to the group of disorder that produce abnormality of basal ganglia function. Parkinson's disease or the idiopathic Parkinson is the most common form. Secondary Parkinsonian result from the result of identifiable causes including virus, toxic drugs, and tumors. Parkinsonian plus syndromes refer to the conditions that mimic Parkinson's disease in some respect, but symptoms are caused by some other neurodegenerative disorders. What happened in the Parkinson's disease? In the Parkinson's disease, loss of dopamine result in the akinesia, rigidity, and bradycardia. Then degenerations of dopaminergic neurons that produce the dopamines, loss of the melanins containing neuron produce characteristics change in the depigmentation and formation of the Lewy body. This occurs in the Parkinson's disease. The brain cell lose the dopamine hormone, which is the produced by the dopaminergic neurons. Causes of the Parkinson's disease. The exact causes of Parkinson's disease are not yet fully understood, but research suggests that both genetic and environmental factors play a role. Genetic mutation have been linked to some cases of Parkinson's disease, while exposure to certain toxic and chemical may also increase the risk of developing the disease. Pathophysiology. This is the cycle. We will discuss about the pathophysiology. What will we analyze the stage of the Parkinson's disease, and this is the physiology of the Parkinson's disease patient. First step of the pathophysiology is the recruitment of the patient with the Parkinson NCI. This is the drugs, inform the content, and pre-TM baseline assessment, neuro testing. Then we will it is the 2.5 SD of the MDRS furous implant incompatible with the MGE and MGI medication known to increase the risk of the seizure. And then randomization, a real treatment, and sham treatment. It consists randomization consists of the 2 real treatment and the sham treatment. Real treatment consists of the 10 days and sham treatment consists of the 10 days. Okay, next post-TM output evaluations, then 28 days post-TMS, and then final analysis data. We will analyze the state of the Parkinson disease occur in the Parkinson patient. Function of the basal ganglia. Basal ganglia play important role in the planning and the progressing movement by selecting some inhibited specific motor synergies, and basal ganglia play important role in the Cognitive process, primarily the CUDA nucleus, including the awareness of the body, orientation in the space, ability to adapt behavior, task requirement changes, and motivation. Then pathophysiology of normal physiology, we have discussed about the Parkinson patient. Then basal ganglia consists of the two parts. One is the input and other is the output. The main input structure of the basal ganglia, sternum, input and output. Input received from all the body of cerebellum, cortex, and the substantia nigra parts compacts by the globulus pallidus and the substantia nigra parts reticulus, then toward the thalamus and then back to the cortex. Okay, this is the pathophysiology of normal person. And clinical presentation, one of the clinical hallmark of the hallmarks of the Parkinson disease defined as increase the resistance to passive motion, felt uniformly in the agonist and the antagonist muscle in both directions. Spinal stretches reflexes are normal. They have the two type Parkinson clinical presentation have the two types, cone wheels and lead pipe rigidity. Cone-wheel rigidity, jerky, ratchet-like, resistant of massive movement and muscle alternatively tense and relax. Lead pipe rigidity, know the fluctuations, more sustained resistance to passive movement. Prolonged rigidity result in decrease the range of the motions and serious secondary complication of the contractures and postural deformality. Clinical figure of Parkinson disease. This is the cardinal figures, other motor figures, and non-motor figures. We have given the comparison like the bradycardia in the cardial figures and micrographia and anomia. Respiratory mode, mass species, and sensory disturbance. For example, pain, non-motor figures. And then gait disturbance, postural instability, soft voice, in the other motor figures, and non-motor figures, sleep disturbance. And in other motor figures are the dysphagia, automatic disturbance in the non-motor figures, freezing in the other motor figures, and cognitive impairment, dementia. These are the symptoms occurs in the clinical figures of Parkinson patient disease occur. Then bradykinesia, akancia. Absence of movement. Movement of freezing may occur and are characterized by sudden break or block in the movement. Like you can see the hand of Parkinson patient tremors. And hypokinesia reduce the amplitude of the movement. And bradycardia and difficulty maintaining the movement are typically reduced in the speed, range, and amplitude. Rigidity and depression also influences bradycardia. It is the most bradycardia, slowness, disabling symptom of Parkinson disease. Motor planning and motor learning. This is the initial stage of Parkinson disease, and this occurred in the Parkinson patient. Start the hesitation in the evidence, especially when the disease progress. Parkinson disease patient typically demonstrate micrographia like the symptom we have discussed in the non-motor neurons, and abnormality, small handwriting, and this is difficult to read. Freezing episode occur can be the triggered. Freezing episode can be the triggered by the confrontations of the competing stimuli. Poverty movement is demonstrated by the patient of the Parkinson disease in the form of the hypomimia, i.e. the reduction in the expressiveness of the face, marked face. This led to be the mental fatigue and the lose of the motivation. Procedural learning deficit are the common in the patient with the Parkinson disease, while the declarative learning is the usually interact. Gait. An abnormal stop postures contribution to the development of the feast in the gait, characterized by the progressive increase in the speed with the shortening of the strides. Gaits can also be the teripulsive, a forward fascinating gait, or retropulsive, a backward fascinating gait. Some patients are able to stop only when they come in the contact with the object on the wall, and plant arc flexions contractions led to toy walking and add to the posture instability. Sensation. No primary sensory loss. 50% may experience paresthesia and pain, numbness, tingling, coldness, itching, pain, and burning. Some of the pain and discomfortable can result from the postural stress syndrome, secondary to lack of the movement, muscle rigidity, faculty posture, or the ligamentous strain. Some can experience akathisia, a sense of the inner restlessness and need to move. Proprioceptive regulation of the voluntary movement may also be impaired. Speech, voice, swallowing, dysphagia. Impaired swelling as the result of the rigidity, reduce the mobility, restrict the range of the movement. This can lead to be the choking or inspiration, pneumonia, and impaired nutrition with the significant weight loss. Nutritional inadequacy, contribution to fatigue and exhaustion, presence of the siluria, excessive drooling, as there is increase in the salivary production and decrease in the swallow. Hypokinetic dysarthria, characterized by decrease the voice volume, monotones, monopitch speech, imprecise or distorted articulations, and uncontrolled the speech rate. Speech is the hoarse, breathy, and harsh. Reduce the mobility, restricted range of the movement, and uncontrolled the rate of the movement of the muscle, controlling respirations, phonations, resonation, and articulation is the present. In advanced cases, patient demonstrate mutism. Cognitive functions and behavior dementia occur in approximately 20 to 40% of the Parkinson's disease patient. This is characterized by loss of the executive function like planning, reasoning, abstract thinking, and judgment. Changing in the visual-spatial skills, memory, verbal fluency, bradycardia disorder of the intellectual function. It is characterized by the slowing of the thought and information process. Patient demonstrate the problem with the select attention and in shifting attention. Hallucination and delusion are the common complements owing to L-dopa toxicity. Depression in the Parkinson patient is the common. ANS systems dysfunction occur with the Parkinson's disease. Thermoregulatory dysfunction, excessive sweating, and the abnormal and uncomfortable sensation of the warmth, coolness. Seborrhea and seborrheic dermatitis are common. Parkinson's disease patients exhibit abnormally slow the pupillary response, slight and pain. Gastrointestinal dysfunction include poor motility, change in the appetite, siluria, constipation, and weight loss. Urinary bladder dysfunction occur with the common symptoms of the urinary frequency, urge incontinence, and nocturia. Sexual dysfunction also present. Cardiopulmonary functions, orthostatic hypotension, low resting blood pressure, compromise cardiovascular reflexes, cardiac arrhythmia, and airway obstruction. Medication for the Parkinson patient are the Luvodopa, this is known as the Cynamide, and the Amavio. These are the drugs we are used for the treatment of the Parkinson patient. We can diagnose the Parkinson disease with the help of the medical diagnosis, accurate and with the help of the physiotherapy. Accurate diagnosis is the possible only with the continued observation of evolving clinical sign and symptoms. The diagnosis is made on the basis of history and clinical examination, handwriting, sample speech analysis, interview the question, and focus on developing symptoms and physical examination are used in the preclinical stage to detect early manifestation of disease. The diagnosis of Parkinson's disease can be made if at least 2 of 4 cardinal figures are present. A combined approach of the physical therapy and the pharmaceutical intervention play a key role in the measurement of the patient. Physical therapists should be the fully aware of the medication are present. Physical therapy should be the fully aware of the medications the patient is taking and is the potential adverse effect. Optimal performance can be the expected at peak dosage on state, whereas worsening performance is associated with end of dose cycle off state. The examination and evaluation. The examination and evaluation consist of the following steps. First, the doctor see the patient history, system review, neuromuscular, neuroskeleton, muscular skeletons, and cardiovascular, pulmonary, and then integumentary. Physical therapy. For medication, we have discussed, and for physical therapy intervention, motor learning strategy, large number of the repetition to develop the procedural skills. A random practice order should be the avoided. Environment should be the cluttered, free to avoid freezing episode. Structured instructional set should be the used. External cues like the visual cues, rhythmic auditory stimulations, auditory cues, pulse cues, and multi-sensory curing facility movement by utilizing different brain area. Exercise training consists of following exercise, and we will discuss about this page: relaxation exercise and flexibility exercise. For the relaxation exercise, these are the steps involved, and we will do the exercise to the Parkinson patient with relaxation exercise, gentle rocking to produce the relaxation, PNF techniques to rhythmic initiations, relaxation audio tabs, lifestyle modification, and management technique. For flexibility exercise, emphasize the active range of the motions, ROM exercise in the physiological pattern of the movement, traditional stretching technique, passive positioning to correct the thumb pillow postures, mechanical stretching by use of the tiled tablet. Functional training. Functional training consists of the mobility in the bed, exercise in the sitting posture to improve the pelvic mobility, sit to stand transition, standing training, teach how to get up after a fall, mobilizing the facial muscles, collecting, eating, impairment, verbal skills practice with the beneath control. Cardiopulmonary training. Cardiopulmonary training, diaphragmatic breathing exercise, air shifting techniques, exercise that record neck, shoulders, and trunk muscles, improving the chest wall mobility by PNF techniques. The supervised aerobic pool program can be administered. Group and home exercise. Patient benefit from positive sport, Kamaria die, and communication with the group situation offer stretching exercise and calisthenic involving the large joints can be used as initial warm-up activities. The self-supervised home exercise program is effective in improving the motor symptoms, same as therapy supervised program to do. The chemistry of Parkinson's disease. Treatment of Parkinson's disease involves complex chemical process that interact with the brain nervous system. Medication used to treat the Parkinson's disease by increasing the dopamine, the level in the brain, which help to improve the function. Other the medication used to treat Parkinson target specific neurotransmitter in the brain to help manage the symptoms. Understanding the chemistry behind these medications can help researchers develop new treatment for the Parkinson's disease. Thank you for my side. From my side, if you have any question, please comment on this below this video.